We've got our daily report on COVID. It continues to be higher than any of us would like, with 910 new cases of COVID-19. 146 of those cases are kids 18 and under. Our positivity rate up from yesterday at 4.11%. Our total number of cases now 69,728. New cases by county: Jefferson 176, Fayette 159, Madison 44, Hardin and Laurel 25, McCracken 22, Davis 21, Christian, Harlan, and Whitley 18, Callaway 17, Kenton and Warren 13, Allen and Boone 11, Jessamine 11, and then Graves, Henderson, and Meade 10. Number of other counties in single digits. They are all available on the website. Next one's hard. 910 cases is hard, but today we're reporting 17 deaths. That makes this, I think, about the fifth, or right around the fifth highest day. That's pretty sad when 17 is just the fifth highest day. It'll bring our total number of deaths to 1,191, meaning by the end of the week, we will probably hit 1,200. I'm looking at the wreath that we hung in here when we reached 1,000 deaths, and to think that we've added 20% in that short time just shows that when we have a lot of cases, sadly a lot of death follows. Remember, these are people's moms and dads, grandmothers and granddads in some instances, sisters and brothers. They're all going to be missed. There are 17 families that are going to be struggling, or have been struggling before today, but let's light our homes up green. Let's ring our bells at 10 a.m., but let's do more than that. Let's wear the masks and follow the rules to make sure that we lose fewer people. It is on us, and it is up to us. So today's report includes an 82-year-old woman from Scott County, a 92-year-old woman from Lewis County, a 76-year-old man from Warren County, a 90-year-old woman from Warren County, a 76-year-old man from Jefferson County, a 93-year-old woman from Scott, an 85-year-old man from Warren, a 95-year-old woman from Scott, a 71-year-old male from Jefferson, an 84-year-old woman from Warren, a 29-year-old woman from Clark. First individual in their 20s that we've lost here in Kentucky. 72-year-old woman from Callaway, 63-year-old woman from Boyd, 84-year-old woman from Jefferson, 67-year-old woman from Clark, 94-year-old woman from Mercer, 88-year-old man from Mercer. And while it's not included in here, and it probably won't for a couple days, got a text from a good friend about an hour and a half ago who just lost his dad to COVID. Anybody want to suggest this isn't real? How to talk to him. These are people we love, and we've lost too many of them. And we're not asking a lot for people to do the right thing, to follow those top 10 rules. If you can put them up, I'm not going to go through them at the moment. But little things. Wear a mask. Socially distant. Keep your groups down. Follow the other guidelines that are out there. You know, these things normally aren't the difference between being a good person or a good citizen, but right now they may be the difference in somebody living and somebody dying. Please do the right thing. Do it every day. I don't want to read off 17 individuals again. It hurts every time, but it doesn't hurt me nearly as much as hurts my friend who lost his dad, or so many others across the Commonwealth. Long-term care facilities: 32 new residents, 37 new staff, 2 new deaths attributable to it, 1 new facility. Colleges and universities: 78 new students, 0 new faculty or staff, 2 new cases. To give you an idea, while this is it hadn't been deadly to college and university students at the moment, there are 1,589 active cases at colleges and universities just with students. There is less than half of that, 644 residents in long-term care facilities. Shows you the real number of cases that are there. K through 12, remember, this lags the dashboard that Dr. Stack will talk about. 34 new students, 23 new faculty or staff, at least 15 new schools with one case associated with them.